Weiler, the face behind Spoomento, the mentoring for Spoonies, which are chronically ill people. I suffer from ME CFS myself and am committed to greater attention and awareness for chronically ill people. I see myself as their ambassador, giving these peoples and their families a voice. This video series is about the medical jargon, which unnecessarily complicated things. In this video series, complex clinical pictures and technical terms were clearly presented and simply explained. I like to follow the KITH method. Keep it short and simple. The videos are also subtitled, so now enough for the introduction. After a short note, we get started.
Demnächst on Air. Nervennahrung. Der Podcast für Spoonies mit Jörg Weiler.
ME, CFS stands for myalgic encephalomyelitis, ME, and chronic fatigue syndrome, CFS. To define the term ME, CFS is a complex and chronic disease characterized by persistent, extreme exhaustion. The term myalgic encephalomyelitis refers to muscle pain, inflammation of the brain and spinal cord, while chronic fatigue syndrome refers to the main symptom, long-term fatigue. It is important to take a closer look at the definition of fatigue. The term fatigue is often used in the context of ME, CFS, and its meaning goes far beyond the simple term tiredness. In relation to ME, CFS, fatigue includes deep, persistent exhaustion that is not improved by rest or sleep. Regarding persistence and severity, fatigue in ME, CFS is persistent and often disproportionately severe compared to the exertion that triggered it. Sufferers often describe this exhaustion as overwhelming and different from normal fatigue. ME, CFS is divided into levels of severity from mild restrictions to bed rest. Regarding cognitive fatigue, in addition to physical exhaustion, many people with ME, CFS also experience cognitive fatigue. This is manifested by difficulty concentrating, memory problems and mental fatigue. Regarding the effects on different body systems, fatigue in ME, CFS not only affects energy levels, but also affects various systems in the body, including the immune system, the neurological system and the endocrine system. Regarding variations in severity, the severity of fatigue can vary in people with ME, CFS and may change over time. Some days or periods may be better than others, but the underlying difficulty with fatigue remains. Overall, it is important to emphasize that fatigue in ME, CFS should not be confused with normal fatigue. It has a significant impact on the quality of life of those affected and requires individual management that requires a careful balance between activity and rest. Regarding the numbers of those affected, ME, CFS affects millions of people worldwide, although the exact number is uncertain as many cases may go undiagnosed or be misdiagnosed. ME, CFS is relatively common and is not a rare disease. According to estimates, 250,000 people in Germany suffer from ME, CFS. Other estimates put the number at up to 500,000 people. According to other estimates, up to 25 million people worldwide are affected. It affects all age groups, including children. In addition, women are affected 3 times more often than men. ME, CFS is one of the diseases with the lowest quality of life ever. In some cases lower than in stroke, heart failure or cancer patients. Studies have measured the lowest vitality and functionality values of all chronic diseases in ME, CFS patients. There has been little research into ME, CFS for decades, although the WHO included ME, CFS in the International Classification of Diseases ICD in 1969. Biomedical and clinical research in particular has been greatly neglected. One reason for the low level of research is that countries provide little international funding for research. Source note: figures from the German Society for ME, CFS Hamburg as of March 2023 about the main symptoms. In addition to persistent fatigue, the main symptoms of ME, CFS include muscle pain, sleep disorders, concentration and memory problems, as well as extreme exhaustion after physical or mental exertion. In total there are around 200 different symptoms. Regarding current research, the exact cause of ME, CFS is not yet fully understood and there is no specific diagnostic test. However, research suggests complex interactions between genetic, immunological and environmental factors. About therapy, there is no specific cure for ME, CFS, and treatment often focuses on relieving symptoms. Management often involves a combination of rest and symptomatic therapies. Activation therapies involving light exercise are outdated and rather counterproductive, as they often lead to worsening of the symptoms. Patients must learn to cope with their reduced energy levels and always carefully consider which activities are feasible, while maintaining strict break management. Regarding the diagnostic assessment, the diagnosis of ME, CFS is a challenge because it is based on the exclusion of other possible causes. It requires careful evaluation of symptoms and collaboration between patients and diverse physicians from different disciplines. Early diagnosis can help provide appropriate support and treatment. Unfortunately, those affected still receive too little recognition and attention. Clarification is therefore really necessary, in the public, but unfortunately also in the medical profession. This information film is intended to contribute to this. Please help and recommend this film to others. All those affected and their relatives are truly grateful if they make this small contribution. Thanks so much.